So welcome everyone. So today we are going to have a live session on the FMGE MCQs, and this will be just a quick revision of whatever topics which are already you must have studied, and it is relevant to only the topics which will be asked in the FMGE exam. And we can have two sessions for anatomy here, and I will cover only the basics part, and we will try to go into the details of some questions. We'll quickly go through that part, and we'll start with the upper limb and lower limb today and thorax. We'll try to start some more head and neck part. Then we will try to add the other parts. Now regarding the FMG exam, hope I'm audible. If I have any doubts, you can put in the chat box. And regarding the FMG exam, some topics are high yield topics. What are these high yield topics? These topics are commonly asked, and these topics in any exam, or whether it is a NEET PG or next PG, these topics are commonly asked. The FMG has some set of topics. Regarding the upper limb, these are the commonly asked topics. Okay, we have rotator cuff muscles, winging of scapula, cubital fossa, fracture of bones, nerve injuries of the upper limb, carpal tunnel syndrome, and scaphoid fracture. Okay, now we'll just see first a question. Okay, a 27-year-old male presented with a partial tear after forcefully throwing a ball. So these sort of case scenario based questions will be asked in the FMG exam. Nowadays it is more because we are going to the next era. That is, next era is the next exam, and the next exam on NEET PG or FMG, it is all conducted by the same body. So we'll have some questions, and they are moving towards the case based scenarios. So the case based scenario questions you should be able to throw. Now how to approach these questions? So I am just how to approach this question. So just read the first point. It will be like an age group will be given. 27-year-old male presented with a partial tear after forcefully throwing a ball. Maybe he has an injury on the shoulder, or right shoulder or left shoulder. After throwing a ball, he presented with the pain, and the tear is seen on the MRI picture. Limited range of movements. What is this range of movements? When you are just abducting, no, the orthopedician will be testing that. There is limited range of movements, and there is pain on overhead movement of the shoulder. So overhead movement of the shoulder, what do you mean by overhead? We will be doing that movement when we are combing our hair. That movement is called the overhead movement. So that is a common movement which we will do on all activities. So in that movement, the person is receiving pain. Now, what are all the following muscles are related to this except? So all except word, you should be concentrating on an except word, because that part we have to see. Now, what is rotator cuff muscles? The rotator cuff muscles are the muscles which are present on the shoulder joint. I'll just draw. So what are the options given? We got supraspinatus, infraspinatus, teres major, and teres minor. Okay. Now we got the shoulder joint is like this. So what is shoulder joint? We got this is the glenoid fossa of the scapula. Okay, this is the scapula, and we got the head of humerus is here. So this is the shoulder joint. Shoulder joint is actually a shoulder joint complex. So this is called glenohumeral joint, GH, glenohumeral joint between the head of humerus and the glenoid cavity of scapula. This is called glenohumeral joint. Okay. Now surrounding that, we got some muscles. That muscles are called rotator cuff muscles. Surrounding this glenoid fossa, there is a group of muscles that is called rotator cuff. Okay. It is acting like a cuff. It is protecting the shoulder from dislocation. Okay. So what are these muscles? Now this muscle which is present here is called the supraspinatus. Now we got infraspinatus, and we got one more muscle called teres minor. On the other side, we got a muscle called subscapularis. So we can have a mnemonic SITS. Okay. So supraspinatus, infraspinatus, teres minor. All this will be on the anterior aspect. Okay. On the posterior aspect, we got a muscle called subscapularis. Okay. So this muscle is called subscapularis. You can remember the mnemonic SITS. Supraspinatus, that is coming from, if we have the scapula here. Okay. So this is scapula. We got a spine of scapula which is running like this, and this part. A muscle which is coming from here, can we call it a supraspinatus? A muscle which is coming from here, this is called infraspinatus. And we got one more muscle which is coming from here, this is called teres minor. Note the point, it is minor, it is not major. Okay, teres means round. A round muscle coming from here is called teres minor. The other side of the scapula, this is the posterior side of scapula. On the other side, on the anterior side, one more muscle is there, that is called subscapularis. So all this muscle will come and attach here as a rotator. As they act, all these tendons will be attached. So if you just join all these tendons, you can see it is acting like a cuff which is preventing the superior dislocation. That is called rotator cuff muscles. So this is a rotator cuff muscle. The person, if you have a tear in this rotator cuff, if you have an injury in this rotator cuff, any muscle maybe, if you have any tendon injury on these 4 muscles, that is called rotator cuff injury. Okay, the person will perceive, because this is essential for the overhead abduction. When you do like this overhead abduction of the shoulder joint, these rotator cuff muscles are required. Okay, so it is also, now we got the answer. That is supraspinatus, yes, it is there. Infraspinatus is there. Teres minor is there. The key word is the minor. So always look for the distractors in the MCQ. When you are approaching an MCQ, distractors will be there, because you know teres minor and major, but which is exact, that is this is the distractor. Okay, this is not the teres major. So what is the answer for this? This is the teres major. So approach the question, first a case, then what is the point they want to mention, then you can come to the conclusion. Okay, this is called the rotator cuff muscle question. So winging of scapula, one more common topic which is asked, that is called the winging of scapula. So what is winging of scapula? So we got a scapula here. Okay, so this is the neck. So where we got the scapula is there on the back of this. Now normally when you see on the back, you will not see the medial border of scapula will not be visible. Okay, usually it will be buried in the, okay. Now if you got this part of the scapula which is projecting, so this part is called the medial border. As I told you, this is the spine of scapula. If you got this is called the medial border of scapula, this is the lateral border of scapula. Usually the scapula will not be visible for all of us. Okay, but if you have a medial border of scapula is coming out, that is called winging of scapula. If you see that in a patient, the winging of scapula means the medial border of scapula is projecting out, that is called winging of scapula. So what is winging of scapula? Projection of the medial border of scapula. Okay, so projection of the medial border of the scapula. Now they are asking not the condition, which border is projecting. They are asking what is it due to the injury of. Okay, now for that you can approach, you see the distractors here are, you see they are giving dorsal scapula, now suprascapular. The student will tend to think that something is related to the scapula that is projecting. Okay, now you should know that the medial border is kept in position by a muscle. That muscle is called serratus anterior. Note down this in your notebook. Okay, so these are the topics which are commonly asked, so you should have an idea. This muscle is called serratus anterior. As I always say that if you understand the terms in anatomy, anatomy is a very simple subject to understand. If you don't understand, just mug up, you cannot catch the point. So serratus anterior, what is serration? So this is a muscle which is having digitations, that is, it is having serrations. One is anterior, another is posterior. We'll come back when we read the muscles of the arm. But as of now, the medial border of scapula, it is kept in position by means of this muscle, that's called serratus anterior. So who is the nerve that is supplying the serratus anterior? It is called nerve to serratus anterior. The other name for nerve to serratus anterior is called long thoracic nerve of Bell. This is the same Bell who has invented the discovered the Bell's palsy. No, so he has described a condition called Bell's palsy. The same Bell, he has described this condition called winging of scapula. It is due to the projection, due to the nerve called nerve to serratus anterior. The other name is, because if you put nerve to serratus anterior, the students will answer. So they have given the other name, that is called long thoracic nerve of Bell or long thoracic nerve. This long thoracic nerve is responsible for the muscular supply of serratus anterior. So it is not the rhomboids, it is not the dorsal scapular nerve, it is not the suprascapular. This suprascapular nerve will supply this supraspinatus. Dorsal scapular nerve also the scapular muscles. Rhomboids will supply the rhomboid major and minor. So these are the nerves which are related to the scapula, but it is not leading to winging of scapula. Winging of scapula means serratus anterior is paralyzed. Why? Because this nerve is not working. So this is lead to the winging of scapula. So in the upper limb, we are going from an order from the shoulder joint. Now we have gone to the scapula, that is called the winging of scapula. Now we are coming to the arm. There are some questions. I will come back to the arm question. Now one more important topic here is called the cubital fossa. So what is cubitus? Cubital fossa means, cubitus means elbow. Okay, so when we see that arm here, okay, this is the arm. What is this? Is the elbow joint. If you approach the arm in the anterior aspect, this region have a triangular fossa that is called cubital fossa. Cubital fossa is present in the anterior aspect of the arm. You must have seen that the laboratory technicians will take blood from this area, no? So that area is called cubital fossa. A small triangular fossa is there, that is called cubital fossa. Now what they are asking is the contents of the cubital fossa. Okay, what are the contents? There is one mnemonic for this. After that, we'll just see this diagram. So this is a diagram which is showing the cubital fossa. Now what is this? This is the humerus. This is called the medial epicondyle of the humerus. This is called the lateral epicondyle of the humerus. So if we draw the humerus on the lower part, it will be like this. So there is a medial epicondyle and lateral epicondyle. Now you draw an imaginary line connecting these two epicondyles. Now we got some muscles. We can see like a triangle. This triangle is called the cubital fossa. So what are the boundaries of? First we'll see the boundaries, and because some question can come as boundaries of the cubital fossa. Now what is this part? This is the lateral part, and this is the medial. This is the medial aspect. This is the lateral aspect of this cubital fossa, and this muscle on the lateral aspect is called brachioradialis. So whichever topic you read it thoroughly, and the common topic, read better. Okay. And on the medial aspect, we have a muscle called pronator teres. Pronator teres. Brachioradialis. What does the word mean? Brachia means arm. It is going to the radial side. I told you lateral side. That means the radius bone is here. So this muscle is starting from the brachium or the arm and going to the lateral aspect. So it is called brachioradialis. Now what does this term means? Pronator teres. It is a pronating muscle which is round in shape, which is starting from this medial epicondyle and going here. Okay. I'm not talking about the attachments. I'm just saying that we have two muscles. One is the brachioradialis, another is the pronator teres. That forms the triangular fossa. So if you see the lateral border, if they ask you in the MCQ, that will be formed by the brachioradialis. What will form the medial border of this cubital fossa? Pronator teres. We don't have a muscle on the, if you see it's a triangle, we have two triangles. This is the base of this triangle, this is the apex of this triangle, this is the base of the triangle. Base of the triangle, you see there is no muscle. So we have to take an imaginary line connecting the medial epicondyle and lateral epicondyle. That is the dotted line we are taking. So that is the base of this triangle. What forms the apex of this triangle? The brachioradialis is running over the pronator teres. That point is called the apex of this triangle. Okay. So we got the borders right. Pronator teres, brachioradialis, and a line connecting the medial epicondyle and lateral epicondyle. Now what is the content of this triangle? The contents of this triangle, the common word we all use, no, MBBS. So we can use this mnemonic MBBS. So what are the contents? From medial to lateral, MBBS. Medial to lateral, MBBS. What is this M? This M stands for median nerve. M stands for median nerve. Okay, then B stands for brachial artery. Okay, then what is this T? I've not told about this muscle. This is the biceps muscle. So the muscle is called biceps. So it is not the biceps muscle, it is a tendon of biceps. This is the biceps tendon. Okay. Last, we got a nerve which is coming on the lateral aspect, that is called radial nerve, especially superficial branch of radial nerve. Superficial branch of what nerve? Radial nerve. Okay. So we got the cubital fossa in detail. Okay. So the borders we have learned. So what are the 4 points? M, B, B, S. We got a B, that is the brachial artery, and we got the another B, that is the biceps tendon. S is, what is S? That S is the superficial branch of radial nerve. So these are the contents which are coming to the cubital fossa. We got a roof contents, we got a floor contents also, but the roof is formed by a vein called median cubital vein. There is one vein running over here that is called the median cubital vein. Some question can come from the cubital fossa. What is the roof of this? This is a vein that usually will be taken for drawing any blood sample. That vein is called median cubital vein. What is the floor of this? The floor is formed by one more muscle. Okay, floor is formed by a muscle called brachialis and supinator. Okay, I'll share this text also in the PDF, which we'll be sharing after the class. Okay, so this is the part called cubital fossa. Now you approach the question. After you understand a topic, try to approach the question. All of the contents of cubital fossa, if you know the mnemonic, it's very easy. So what is there? We got the median nerve, we got biceps tendon, brachial artery, superficial branch of radial nerve. Instead of that, they have given another nerve that's called musculocutaneous nerve. So this is the answer. So it's an except question. This is the exception. So the answer is musculocutaneous nerve. Okay. Hope you learned this cubital fossa in detail now. Now, there is one more topic which is commonly asked in upper limb, especially in FMG or an EPG, that is the nerve injuries of the upper limb. It will be a case scenario based question, and the question will have some details related to the injuries, the nerve injuries of the upper limb. So now a patient is presenting with the pain on the medial side of elbow joint. On examination, there is a fracture of the medial epicondyle. Which nerve is injured? So the person is presenting with any road traffic accident or any accident. The person is presenting with the pain on the medial side of elbow joint, and there is a fracture on the medial epicondyle. Okay, which nerve is injured? So what the nerve given? They have given the median nerve, radial nerve, musculocutaneous nerve, and ulnar nerve. So all these nerves are given. We will just see that. You see, one more question. Again the same scenario with the medial side of, and on examination or an X-ray examination or a radiograph, we can see that there is a shaft of femur fracture. The question can be, I think there is a wrong here. The question can be framed as not in the medial side, on the present as a swelling in the middle of the arm with a shaft of femur fracture. Which nerve is injured? See the case scenario. Even almost in the pain and swelling on the elbow joint following an RTA, there is a supracondylar fracture. What is supracondylar fracture? I will tell you now. So which nerve is injured? So the question can be related to the humerus, but in 3 different scenarios. So the first thing is fracture of the epicondyle, second is shaft of humerus, third is supracondylar fracture. Okay. Here they have not asked the blood vessel, not asked about the nerves. You see the options have changed. It is ulnar artery, brachial artery, radial artery, and profunda brachial artery. Now to approach this question, if you know this point, it is very easy. Okay, so this is a humerus diagram. You can see this is the head of humerus. Okay, this is the neck of humerus. We got a greater trochanter, a lesser trochanter. Now this part is called the neck of humerus. If I draw the humerus again, so we got 3 neck in the humerus. This is called the anatomical neck. Okay, and we got a neck here. This is called the surgical neck and the morphological neck. So anatomical neck, surgical neck, and morphological neck. Surgical neck in the sense that this is the commonest site of fracture. If we got a fracture here, this is called a surgical neck of femur fracture. Now one nerve is going along this line near the surgical neck. What is the name of the nerve? Write it down in your notes. It is called axillary nerve. Axillary nerve. will be winding around the surgical neck of humerus. Okay. One more nerve which will be on the shaft of humerus. In the long bone, you must have read that this is the shaft of humerus. We got a shaft and upper end and a lower end. So in the shaft, on the posterior aspect, there is a groove here. The name of the groove is called radial groove. The name of the groove is called okay. Now a patient is presenting with the pain and swelling in the elbow joint following that the injuries of the upper limb is a commonly asked topic. The question can be related to the case and you just observe that where the person is having pain and then sometimes they will give you the diagnosis, sometimes an X-ray can be given, X-ray of supracondylar fracture, X-ray of this neck of fracture. Now all this question can be learned by this diagram. Now what you have here, this is called the head of humerus. I have drawn a schematic diagram of the humerus. You can see this is the head of humerus, this is the neck of humerus, and in neck we have anatomical neck, morphological neck, surgical neck. There are three necks in the humerus: anatomical neck, this is a surgical neck. Why surgical neck? Because we can usually it is the commonest site for fracture between the upper end of humerus and the middle of the humerus. This is called a shaft of humerus. Okay. Now this is called a surgical neck of humerus. On the surgical neck, over the surgical neck, we got a nerve which is coming out, winding around. That nerve is called axillary nerve. So axillary nerve will be winding around like this, winding around the surgical neck. So if we have a fracture on the surgical neck, which nerve will be injured? Axillary nerve will be injured. Okay. So in case of fracture of surgical neck of humerus, which nerve will be injured? Axillary nerve will be injured. Now one more nerve is there which will be running on the radial groove. What is radial groove? On the posterior aspect of the shaft, you will feel a small groove is there, that is called radial groove. On the radial groove, what nerve will run? The name itself says that radial nerve will be running. Now if we have a fracture of shaft of humerus, which nerve will be injured? Okay, so shaft of humerus fracture, which nerve will be injured? There will be radial nerve will be injured. Okay, now on the lower aspect, we got an epicondyle. This is called medial epicondyle. This is called lateral epicondyle. We have, this is called a capitulum. This is called trochlea, capitulum and trochlea. Behind the medial epicondyle, there is one nerve which will be running, that is called ulnar nerve. So ulnar nerve will be running behind the medial epicondyle. It is also called a funny nerve. If sometimes if you hit on a table, no, you will feel a current-like sensation. Why? Because you are hitting on directly on the medial epicondyle. Behind that, you are seeing the nerve. You are feeling on the nerve. So that is called the ulnar nerve. Now, if I have a fracture here, which nerve will be getting injured? Ulnar nerve will be injured. So if the case is saying about a fracture on the surgical neck of humerus, axillary nerve will be injured. If there is a shaft of humerus fracture like this, there will be radial nerve will be injured. Fracture of medial epicondyle, ulnar nerve will be injured. Okay. Now surgical neck, if we have a surgical neck of humerus fracture, what nerve will be injured? Axillary nerve will be injured. If we have a fracture on the radial groove, what nerve will be injured? Radial nerve will be injured. So three nerves. Okay. Imagine in this diagram, you can see if you have a fracture. Imagine in this diagram, you can see if you have a fracture here. So median nerve is slightly lateral. What structure is injured? It is not this brachial artery will be injured. So in this same scenario, if you have a structure, the brachial artery will be running here on this region. So if you have a fracture on the supracondylar region, which artery will be injured? Brachial artery injured. So the brachial artery will go for an injury. There will be an it's not injury. We will go for an abruption. There will be more bleeding, and the person will have injury on injury on the brachial artery. So you can see that on the brachial artery. So you can see that. So in this option, what is the ulnar artery? On the this is the radial artery. This is the ulnar artery. Okay. So this also can be asked where the brachial artery divides into radial artery and ulnar artery. At the brachial artery divides into radial artery and ulnar artery at the neck of radius. This is a neck of radius. This is a landmark. Neck of radius is a point where the brachial artery is dividing into radial artery and ulnar artery. So which artery will be injured on a supracondylar fracture? It will be the brachial artery. Injured on a supracondylar fracture, it will be the brachial artery. So this artery is called the brachial artery. You can see in the diagram. Brachial artery, and we got a branch on the posterior aspect. This is called the profunda brachial artery. Okay. So now you approach the same question. A person presenting with the pain on the medial epicondyle, medial side of the elbow joint. There is a fracture of the medial epicondyle. Now which nerve will be injured? Medial epicondyle fracture. Do we go median nerve? Median nerve is coming in the anterior aspect of the arm. It is not going to get injured. Okay. Radial nerve is coming to the posterior part of arm. It is not getting injured. Musculocutaneous nerve also no. Ulnar nerve. So medial epicondyle is a catch point here. You should always see the clue point here. If you have a fracture of the medial epicondyle, ulnar nerve is the answer. Okay. Now here also the same thing. Median nerve, radial nerve, and musculocutaneous nerve. A fracture on the shaft of humerus. That means a fracture can. Okay. There is an ischemic contracture also can happen as a complication of this. It is called Workman's ischemic contracture. So these are the three options. Workman's ischemic contracture. As a complication of supracondylar fracture, what can happen? It is called Workman's ischemic contracture. This also can be asked. Complication of supracondylar fracture. That is called Workman's ischemic contracture, VIC. So these are the common topics related to the upper limb. Okay. Now one more question. So this is a fracture of clavicle, a schematic diagram. This is humerus, this is scapula, and this is clavicle. Clavicle, we divide them into a medial 2/3. So clavicle, we divide them into a medial 2/3, lateral 1/3. Okay. So if I draw the clavicle, usually it will be like this, an S-shaped curve. Okay. So the clavicle will be like this. So we usually divide this in this region into a medial 2/3 and 1/3. This point is the weakest point of the clavicle. This point is the weakest point. The fracture will happen usually on the weakest point. So the weakest point is junction of medial 2/3 and lateral 1/3. So this is the commonest site of fracture. Now I'll ask you one question. So if there is a fracture, how the person will come out? There will be this lateral line will go upwards and medial line will go down. Because of the pull of the muscle, it will go up and this will go down. So they will present with a pain. Is fracture of clavicle a common? Yes. One of the commonest fracture of the upper limb is clavicular fracture. But clavicular fracture as such can be managed with easily compared to other. There is no nerve injury or arterial injury related to the clavicle. It can heal area, then we'll come back. So this area, then we'll come back. So this I'll share in the PDF. For nerve supply of I'll share in the PDF. For nerve supply of any muscles, if you know the area, you can answer from this tabular column itself. Okay. Now, if we have a muscle on the anterior compartment of arm, so what will be the so each compartment will have a nerve supply, particular nerve supply. That nerve supply only will come in the MCQ. So this is on the anterior aspect of arm. We got three muscles here. So what are the muscles? Biceps brachii, brachialis, coracobrachialis. Three muscles are there. Biceps brachii. What is the nerve supply? You can answer radial nerve. Now the catch is starting in the forearm. So what is forearm? Between the elbow joint and wrist joint, the entire thing is forearm. How many compartments are there in the forearm? We got an anterior compartment and a posterior compartment. Now anterior compartment is, what is the other name for this anterior compartment? Flexor compartment. Okay, this is called flexor because it is causing the flexion of the elbow joint. Now, flexor compartment, all the muscles of the flexor compartment are supplied by median nerve, and all the muscles of the flexor compartment are supplied by median nerve, except two muscles, flexor carpi ulnaris and half of flexor digitorum profundus. I cannot tell all the names, just because as a quick recap of anterior compartment of forearm, all the muscles are supplied by, so if the FCU is there in the option or half of FDP or the ulnar half of FDP is there in the option, put ulnar now. If any other question is there, pronator teres, flexor carpi ulnaris and half of flexor digitorum profundus. Now when we go to the posterior compartment of forearm, what is the other name for this flexor posterior compartment? It is called the extensor. So it is called extensor compartment of the forearm. So anterior compartment of arm, biceps brachii, brachialis, musculocutaneous nerve. It is supplied by the musculocutaneous nerve. Posterior compartment of arm, triceps brachii is supplied by radial nerve. It is called the flexor compartment. It is supplied by median nerve and ulnar nerve. Posterior compartment of forearm, what is the other name for it? It is called extensor compartment. In the extension of the elbow joint. It is supplied by a nerve that is called pin nerve. Pin nerve is a branch of median nerve. So median nerve will give the posterior intraosseous nerve. Now last part is the hand muscles. Okay, last is the hand muscles. So muscles of the hand is supplied by what? It is supplied by all the muscles of the hand is supplied by ulnar nerve. Okay, all the muscles of the hand is supplied by ulnar nerve except the median nerve. So if you have this idea, you can answer. So hand muscles are supplied by ulnar nerve, and the except the thenar muscles. The thenar muscles